Welcome to On the Line, conversations about ensuring what matters most, presented by Mainline Benefits.
All right. Good morning. This is Arnie with Mainline Benefits with our first podcast on the line. And we decided to bring Saadia on since I've never seen a podcast. And Saadia has been on podcasts before, and she's one of our top agents here at Mainline. And my goal today is to figure out how many bloopers we can get. So,
All right.
how are you doing, Saadia?
I'm all right.
Yeah.
A little
What-
nervous.
What gave you the, when you heard we were doing this, what got you excited about doing the podcast?
I'm excited to grow the business, bring on new agents. I love what I do. I've been doing it for over 6 years now. And I thought this would be a fun way because, insurance doesn't have a sexy sound to it, but we have fun.
Yeah.
So this is going to be fun.
Perfect. So actually, maybe this would be a really good place to start it. How did we meet?
Yeah. How did we meet? Well, I did corporate benefits for a really long time. I decided to retire. I was home. My husband's already independent and we needed health insurance. And I actually did corporate benefits for a really long time. And I thought I knew what I was doing. And I thought I was going to find us a health insurance plan really simply, but it turned out to not be so simple.
Got it.
So I got frustrated, made some calls, and that's how you and I eventually met.
Yeah. So there was, with everything you did from the corporate side, listen, most people get their insurance from work, right? There's not a lot of thinking to do it. Now you made sure they made that easy at work, right?
Mhm.
But when you go off and do it on your own, it's a very different experience.
Yeah, and I'd say that's kind of a unique thing about me is I came to this business with corporate benefits
Yeah.
knowledge and experience. And again, thought, oh, yeah, that would be a pretty easy thing to do. And then when I got here, I realized, you know what? You don't need that type of
Mhm.
experience because the training that's provided through Mainline and the carriers is so extensive that really this opportunity is great for anybody who has the drive and desire to help people and be successful.
Yeah. Awesome. We'll give a shout out to Jeff Horn, who was your agent when you started.
Yes, he
Right.
was.
And he was able to put your family into a group health plan, which was pretty cool.
Mhm.
Right.
Yep, which we're
So-
still in.
Yeah. Oh, got it.
Yeah.
But you're probably your own agent now.
I
assume?
am my own
Okay.
agent. Thank goodness.
Yeah. Okay. Got it.
Yeah.
All right. So do you have a story? We just finished up an extremely busy AEP, OEP, AEP being for Medicare or annual enrollment period. And for people under 65, the open enrollment period. You have any stories from this last season?
I feel like I have so many that I've kind of blocked them out, but it was my most successful AEP, OEP. Reality is we're still in OEP
Yeah, in Illinois we
in
are.
Illinois.
Yep.
Yep. They keep extending the deadline. Story. So I have a sub agent now. And just so happens, she's my best friend since first day of first grade. So that was a big change for me this year and a very positive change. It helped me to have my most successful AEP, OEP. Sandy's been great, and she's been helping me to grow my business. So that's one good story. I have several stories. I'm very fortunate. I help a lot of people who have various stories. I think that's all of us. We all are helping people. So I have so many good stories. I don't even know where to start, but yeah.
You have a under 65, some of you helped with. In Illinois, we did make a change this year that we moved from what's called healthcare.gov to Get Covered Illinois. Obviously, we're a national company, so we have these state exchanges around the country, but we're filming here right now from Chicago, and we did make a change. It's called Get Covered Illinois. And a quick story of something with that and the transition and what it took, either from the consumer side or the agent side.
So at first, it was a little daunting thinking about this change and how was it going to work and moving all these people off of the federal marketplace onto Get Covered Illinois. Fast forward to now January. I feel like actually all things considered, it's not been a bad transition.
Yeah.
The information came over from the federal marketplace pretty well. I mean, one or two things maybe we had to fix, but that actually lent itself to opportunity to engage our consumers, our clients in conversation and being able to see if there's any holes or any other types of coverage that they might need help with or family members that might need help.
Yeah.
So it actually has been a really nice transition, I think.
Yeah.
Like I said, in the beginning, it was a little bit frustrating, but what isn't frustrating when it's new? But now it's okay now that I know how to use the system and things like that. As far as good stories, my business is growing. My referrals are growing. And I went to a family event few weeks ago. And it's interesting. My name is getting out there in the community and and I'm becoming kind of the one to go to. So that's good. That's why it's great I have Sandy.
Yeah.
So that I can manage it. But yeah, so it's going well. It's really going well.
Yeah. So one thing we did decide to do here at Mainline is start, we have actually I'll give a plug out for Joe, our videographer, and he's been meeting with us once a month and interviewing agents, and it's going really well. It's getting it out on social media, and I think it's making an impact. And agents out there in the world, the consumers out there in the world could really see what we do and how we do what we do, and that we don't just care about selling insurance, but we truly care about putting people in the right place. We just thought bringing this, our first podcast and on the line, the idea of actually taking this to a whole different level. So do you see an impact yourself with social media? Are you getting...
Yeah. And over the holidays, as we always talk about, that's when we're meeting up with people we haven't seen in a really long time. And just so happened, I did in December meet up with, literally, I hadn't seen some of these people in 20 years, and just catching up. And I can tell you at least 3 of them said, oh my God, I didn't know what you've been through over the last, 10, 15 years. And I was like, what are they talking about? And it turns out they saw my interview that I did with Joe in the summer. And so they didn't necessarily respond with a comment on social media, but they watched it and they watched the whole thing and it impacted them. I mean, they were really moved by my story, which then of course moved me. I mean, I was practically in tears when I was meeting up with these people. So it's having an impact, even if we don't get the immediate or heart or comment. People are seeing this stuff and they're really and I have received referrals since then. And actually a girl I grew up with, we knew each other or whatever. She's now my client and she lives in India, but her kids are here. And
I was going to say, we don't sell in it just for
we don't, but her kids are here.
Reasons. I wanted to make sure we're not selling in India.
No, but my point is it's reaching international.
No,
and
awesome.
So people, I help a lot of people from overseas. It's just, I guess, one of my niche markets now where when I say from overseas, people visiting or people moving here or family members who live here. Yeah. So, and there's a lot of unique situations with that. So it's becoming one of my strengths, I guess you could say. I'm learning a lot about, who we can help and things like that. So
it's awesome. So do you want to revisit a little bit your story? That might be a really good time to revisit that. And
my story?
Your story.
Yeah. So a lot of people have already heard this, but I did corporate benefits for about 25 years. I'm born and raised here in the Chicagoland area, Roselle, for anybody who knows where Roselle, Illinois is. I went to Northwestern undergrad. I did my MBA at DePaul. So I'm a Chicago girl, although I travel the world, but Chicago's my home. After I retired from corporate because I went through my own health event, I'm happy to say I'm 10 years cancer-free now. So after I went through that, I learned a lot about life. I learned a lot about what's important. I also learned about insurance as far as how impactful it can be to people's lives when it comes to their health, right? So if people are worried about their finances and now all of a sudden they get diagnosed with a condition like cancer or, something like that, and they can't financially afford it, that bothers me.
Yeah.
Right? Because there's ways we can help them. So anyway.
Yeah. People think so much about health insurance, just going to the doctor, going to the hospital, getting that surgery, which it covers those type of things. But there's a lot more to it than just the medical bills.
That's right. Yeah.
And it could truly put somebody into bankruptcy even when they have insurance.
Yeah, because what people don't think about is your bills still, your rent, your mortgage, your car payment, your electricity, your cell phone bills, all of that still continues even though you're sick,
Yeah.
right? And even though you're not working, those bills still continue. So just because you don't have income
Yeah.
from a job or your business, if you're self-employed and something like this happens to you, you got to think about these things, right? So anyway, I retired because life became stressful at work, and I learned that my family's more important than anything else. And then when I needed to find the health insurance for myself, like I was telling you, I thought I was going to be able to do it by myself.
Yeah.
But I couldn't.
Yeah.
I needed help and found Jeff and you. I literally, off that one phone call, I literally hung up the phone and went down to my husband's office and said, I figured out what I want to do. I didn't even know what this was. Like, I didn't know.
You didn't need to go back to work, right? You're
No.
comfortable financially, right?
Yeah, and we have 2 kids, and they're our priority. But I didn't know anything about what a health insurance agent was. I didn't understand. But I literally said, this emotionally how I felt after that call about somebody being able to help me solve my problem was so impactful. I said, I want to do this for other people. I want to help other people. And that's how this journey started. And that was just over 6 years ago. And you and I talk about this all the time. There's signs in the universe. I listen to them. Pretty simple. I mean, there's signs in the universe. I listen to them. I had never heard about this and health insurance agents. We had a vacation planned literally like, I think 2 weeks after our call.
Yep.
Went on vacation. My kids, being kids, they turned on the TV and I saw a commercial.
Yeah.
And I was in Hawaii. So I was really far away from home. And I literally stopped in my tracks. And I looked at my husband. I said, I think I got to do this. So that's how I'm here.
Yeah.
And here we are 6 years later together.
It's just crazy how well you've done when you,
And I started part-time, Arnie.
And
I'm still part-time.
Yeah. So we do struggle that with, a lot of insurance agents out there in the insurance world do this part-time. It's a great opportunity for people to make extra money while they're working a regular corporate job. We have Mainline though. We really, this is full-time for us. And the vast majority of agents we bring on, we're looking and expecting them to work full-time. They're obviously all independent, so they can choose how they want to do that. But just with so much time and energy we put in, I know our very first conversation, I said, listen, you're a client. So I'm going to say, all right, I'm happy to bring you on, but if you're a part-time agent, you're probably not going to get a lot of support from us.
Yep.
It's just, if we're putting a full effort in, it just doesn't make sense. Right. So, so I would have been just as happy if you didn't come on. I was trying to, but to a client, I couldn't say no. All right. And so you're probably, I'm going to say from the standpoint of a part-time agent, you're without a question our most successful part-time agent. And when I say part-time, she's still, you make it to every single basketball game for your kids, right?
Every single game.
You do travel all over the world on a fairly regular basis.
Yes.
Right. And you still get everything done.
And I'm a daughter. I'm a mom. I'm a wife. I'm a daughter-in-law.
Yeah.
I'm a friend. And I still, those are my priorities.
Yeah.
This allows me to do that.
Yeah.
If I had stayed in corporate, I don't know that I'd be able to do what I need to do. I mean, a year ago, my dad was in the hospital for 5 weeks during annual enrollment and open enrollment.
Yeah.
The busiest time of the year. He ended up passing, but because I was able to do this and still be with him every single day. And I don't know where else you can do something like that.
Yeah. We have, that's awesome.
So,
I was just thinking about a story with my son on that one. Zachary, my younger son, he had a trip planned just a couple months ago out to Africa, and he works for a corporate place, and he asked for the vacation days, a couple weeks before he was leaving, and they said no, and he had to cancel his trip.
Ugh.
Yeah. So what a blessing we have, right? To be in the kind of business that literally you could leave in a day, let alone a 2-week notice or a 2-year notice. Just, it's a blessing for sure. And I know you definitely are grateful for that.
Very grateful.
Yeah.
Yeah. It's, not just vacation. I just think about my last year has been pretty heavy from a health standpoint for my dad, my uncle, my dad, my own health. and now my husband.
Mm-hmm.
But I'm still
And
had
your
my best
husband's
year.
Your husband's still here, just to,
Thank goodness.
yeah,
Yes, he
yeah,
is. He's doing
correct,
good. 2
correct.
weeks post surgery, but
Yes.
but my point is, and I still had my most successful
Yeah,
AEP, OEP.
yeah,
So
yeah. Yeah, it's a testament to just you've really been able to put your, yeah, I mean, instead of me trying to put it in words, what do you do differently? Because you really are able to compartment. I don't know what the right words would be. So what allows you to do all of that and, be such good on the, balance your life so well and be so successful on the professional side and helping all the people you are helping? What would you say is the one big secret, that X factor that you have?
I don't know that there is a secret, but my husband says I'm crazy. I do operate on less sleep than probably the average person. He's always said, I don't know how you do it. You can get 4 hours of sleep and still be fully functioning the next day.
Yeah.
For me, what I've learned is the gym. I committed to myself before annual enrollment this past year, that I was not going to sacrifice my gym time for work. And I committed to that and I stuck to it.
Yeah, nice.
So Sandy can attest to it, because there'd be times she'd call me or text me and she'd hear me out of breath because I'd be doing my exercise. But that's something I learned and I've actually implemented, is I got to take care of me first.
Yeah.
Because if I don't take care of me, I can't take care of everybody else I just talked about, including my clients and things like that. So I think that allows me to be successful because I finally decided that I'm going to take care of myself and not feel guilty about it. That was a big piece of it. But then I also, I think I manage my time.
So
I schedule my time.
Yeah. So how do you do that? What do you use?
I have a calendar.
Is that paper? Is that electronic?
No, it's on my phone. I just use because my phone goes with me everywhere. Everywhere my phone goes. So if I did it on paper, I'd be forgetting pieces of paper everywhere.
Yeah.
So I have a calendar. And the things that I calendar are my appointments, my work appointments, my personal appointments. People come in to visit, because I do have I'm very blessed. I have a lot of family and friends who come and visit us, or, the social life. So all that is in my calendar. And then what I do from there is my work time, right? Because even though I have appointments, I still have to allow time to get the work done, because there is work that still has to be done. So I manage that time with my calendar. So I really need that in my life. And I've realized I've gotten better at it. I still can improve, but that's what I use. And that's what keeps me grounded. My kids' schedule. So I have 2 teenage kids. I have a 17-year-old and an almost 16-year-old. They're very busy kids. This week, we had a game every night of the week, another one tonight and 2 tomorrow. And I don't miss any of them.
Yeah.
I don't. And so that's just what it is. It's part of my schedule.
Yeah.
And I schedule my gym time too now.
Yeah. And sometimes you just writing a deal even while you're at that basketball game.
That's right.
Too.
I do.
Yes. No,
or going to a deal at 11 o'clock at night.
Yeah.
Because AEP is coming to an end. And my client texted me and said, I have somebody sitting here who needs your help.
Yeah. Got it.
I said, all right, I'll be there at 11 p.m.
What about a little shout out to your kids and how well they're doing in basketball?
Yes. Both of them are varsity. So I can brag a little bit. Both play varsity. They're good kids. Today they're at a conference for financial business professionals of America. And
Is that you sending them there, or Hamid, your husband?
Or
did they make their own
group?
decision?
It's a group decision at home. We talk about it around the table, being active. Basketball is a large part of our life, but it's not everything. And we talk about long-term success and,
Yeah, and actually your son ended up interning this summer. So with that, we'll see what happens again with next summer, but we put some processes into play to actually have kids of agents be able to do that. So
it was a
really
fantastic opportunity. So
Yeah.
thank you.
Yeah, no, it worked out really well. In fact, to the point where what he was doing was just expected to be done. All of a sudden, some things weren't getting done, and we didn't realize he was done working. I was like, well, why can't he just keep working? I don't think you let him. I think he was okay to keep working. You might not.
He
let
doesn't
him.
He's busy.
Yeah.
He's a high school student.
Yeah, but it was crazy what an impact he made. It was pretty cool.
No, and thanks for the opportunity. Mainline is the work we do is one thing, but I really think the culture and the family we foster here is bigger
Yeah.
than that.
Yeah.
So
Yeah. Speaking of that, we just had our first team meeting back from the season, and on top of celebrating our numbers and the difference we made in people's lives from consumers and some stories of people that had issues and used our products, but we also got to celebrate people getting engaged during the season, right? And we had one person, their father passed away. So it really is a family. So
It is.
it's not just like some agent out there. We truly took the time to celebrate with each one of these people.
yeah, I was actually really excited to come back in the office. I'm like, it's
Mm.
been a really long time. I haven't seen everybody. So yeah, this is a family. I mean, for people who are thinking about career changes or just looking how they can impact the world, I truly think we impact
Yeah.
the world
Mm-hmm.
in our way.
Yeah.
Health insurance is important for anyone. It doesn't matter what their job is or
Yeah.
what business they own. I feel like we just have such a huge opportunity to impact people's lives.
Yeah, and when you say health insurance, again, we definitely do different levels of that, right? So maybe just for, it's, we get caught up in the industry. I know what you mean when you just say health insurance, right? But there's different types of it. There's different, without me, do you want to speak to that? Different age groups, different what they need?
Right. So yeah, we use the generic term health insurance. So we specialize in under 65, over 65, which is Medicare. But we also help with supplemental type of insurance. So life insurance, dental, vision, critical illness, accident, and a few others. So we do more than just health insurance. I kind of tell people when I'm talking to them, people don't think twice about auto insurance or home insurance, right? But when it comes to health and life, I think sometimes the human brain has this weird, oh, I don't really need that, or I'm healthy, or I'm young. And I always talk to people, I'm like, yeah, what about that car accident that could happen? Or what about just tripping and falling? That accident that could happen to anyone. It doesn't matter how old or young you are. I just had a call day before yesterday with someone who has a newborn baby. Newborn, it's a year-old baby. And I had a very lengthy conversation with her about life insurance for that baby. And I said, her 1-year birthday's coming up. Talk to the grandparents about a great birthday present. Why don't you start a life insurance plan for her? And she was like, what? So I talked about all the benefits of why I'm bringing it up. I'm not bringing it up for the death benefit. Don't get me wrong. I'm bringing it up because this is the gift that keeps giving. And from grandparents, I think it's a fantastic gift. So we have an appointment scheduled in 2 weeks to talk about what it's going to cost and all that fun
Can you just
stuff.
speak a little deeper on what you mean by that? Because people think of life insurance as literally, God forbid somebody does pass, right?
Right.
Especially talking about a kid like that.
Right. For babies.
How do you even bring that up? And why would they look at it if it wasn't just for life insurance,
Yeah. So I tell them this is a long-term play. This is not a short-term play. We're going to be talking about whole life insurance. So it's for the life of your child. It guarantees their insurability because you just never know what life might throw at you. And the products that we would look at build cash value. So I'm like, think about your parents or your spouse's parents who give toys and clothes, which are great. They're fine. But these kids, these babies aren't going to remember all that stuff. But when they turn 20 years old, if they have this life insurance policy that now has a cash value of $20,000, $30,000, and now all of a sudden that kid can go to college or buy a house or buy a car. That's the gift from you as the parents or the grandparents. And so it's not just about that. We're not purchasing life insurance for a baby for the death benefit. That's not what we're trying to do here. We're trying to, build a future for them, a financial foundation. And by the way, they will have a death benefit in the future, whenever that might be. So that's what I try to help people understand. This is a long-term savings opportunity for your kid.
Yeah, very good.
And it's very cheap. I tell everybody, you start a whole life policy now. It's cheaper than getting a cup of coffee, once a week in a month. You know what I'm saying? Like
it's a gift that Lily gives for the rest of their life.
Yeah.
Yeah. That's awesome. And the one extra piece I'd say on there, again, what got you here is not only that individual or ACA or Obamacare or how people want to call it. and then the Medicare, but also the employer group that we can help the small group, which is again why you ended up with us.
Yep. Yeah.
Right?
So yeah,
And
we
have you
do
helped
small group plans. Yeah.
yeah, and have you helped some small groups
Yes.
besides your own?
Yes, I
Okay.
have. I have a couple of small groups still that I help and I service. I'm on a small group health plan myself, so we do that as well. So we're pretty multifaceted, I would
Yeah.
say, here at Mainline.
Mhm.
There's a lot, and if we can't help somebody, we know somebody who can,
Yeah.
which
that's
is
good.
another nice resource. We have a lot of networking partners that we work with. So
Yep. Yeah. Okay, good. Yeah. So Sadia, just getting back to your, with you and your family have dealt with some health issues, right? And it can get pretty complex dealing with it from when you started. Um, not just, maybe even going back to you did some HR in the corporate world. When you came here, I know it wasn't, working in the individual market and understanding was very different than that corporate side, right?
yeah.
And now that you have 6 years behind you, and now that a new health issue came up, how do you find the complexities? What have you learned? What is, how have you dealt with that? You speak to that for someone else that might be going through something with their self or their family.
Yeah, and actually, I think what I'm hearing from this question is kind of our value add. Like, how do we as agents, what are we bringing to the table for our clients? Is kind of how I take that question.
Okay.
Because during the last
That's
few,
exactly what I meant, by the way.
yeah,
Okay.
well, because during the last few weeks, I've had a handful of clients who kind of think they're smarter than me. And I say that in jest
Yeah.
a little bit, but they'll get on the appointment with me and they start spewing all this research they've done and the network they've looked at, and they think they know everything. And I'll have to kind of reel it back a little bit and say, well, you're talking to me because I am the expert, and I appreciate that you've done your homework, because that actually just solidifies that you understand you need my help, which is good, right? But there's a lot of nuances to what we do, and there's a lot of understanding how to use the systems. We use a lot of systems, okay? So we have to use provider search tools. We have to use calculators for subsidies. We have to use many different websites. I think our expertise in being able to navigate all those systems and navigate them on an appointment with our clients is really important. And then the other fun thing, I think, it doesn't cost anything to work with us.
Yeah.
I mean, that's pretty huge. Like, I can't tell you how many times I'll have people hesitant to talk to me because they're worried about how much I'm going to charge them.
Yeah.
Or at the end of the appointment, they'll say, okay, how much do I owe you? And I love that question, because I love being able to say, well, you owe me a lot. You owe me a big thank you. You owe me a review, and you owe me referrals to your family and friends. And they're like, no, come on. And I'm like, no, seriously, you just got all that expert help for free. And I'm very transparent with my clients. I tell them, you could do this on your own if you want. Feel free. I'm like, healthcare.gov, Get Covered Illinois, Medicare. You can do this on your own. It's going to take you probably 8 hours, and it's going to take me probably 15 to 20 minutes. And then they're like, yeah, I know, I tried. And I said, yeah.
There you go. Okay.
So I think that's what you were asking.
Yeah. No, that's good. And really is a huge point, because the value they get working with an agent like you or somebody at Mainline, or, truthfully, agents overall, just being a professional out there. And so often to work with a professional, you're paying more for it. You work with a tax person, they're probably going to do a better job than you do on your own taxes. And to get that, though, you have to pay them. In the real estate world, same thing. If you're working with an agent, there is a commission in there that's getting paid out of somewhere where you're paying more if you're the buyer because of it. Here, they're truly, if they go directly to healthcare.gov, they go directly to Blue Cross Blue Shield, they go directly to Humana, they go directly to Penny in Pennsylvania, or to Get Covered in Illinois, they're going to pay exactly the same amount that they would pay if they go through you.
Actually, I would argue they'd probably pay less if they go through us, because we know how to calculate. We know how to ask the right questions to get to the right, for the under 65 market I'm talking about. We know what questions to ask to be able to use the correct income to calculate the subsidy. So it's happened many times and continues to happen where I'm able to actually get them a lower premium and a better plan because I know what I'm looking for and I know what questions to ask them. And they get off they're getting off the phone with me saying, "Oh my God, you just saved me $200 a month." You know, and I'm just like, yeah,
that's what we do.
that's what we do.
Yeah. So if somebody say, well, wait a minute, how do I get all that help and I'm not paying you? What would be your response to that? Like,
Well,
how do you get paid?
Right.
Like, are you doing this for free? Obviously, you're spending all this time. You can't be doing it for free. So what's the catch?
And people have asked me that question.
Yeah. So what's the catch?
So in my opinion, there's still really no catch. We get paid, we get commissions. Okay. From the carriers. And I always specify you on the Medicare side of the house. The really nice thing is Medicare regulates that. So carriers cannot entice us to sell their plan over another plan by paying us a higher commission. So truly, I am an independent, unbiased agent. My job.
You truly could put them in whatever is best for them without worrying about your side of it.
Correct. And I tell people, look, I need to go to bed at night. I don't want to be going to, bed at night with a conscience where maybe I know I could have put you in a better plan and I didn't because I was going to that's not how I live my life and that's not how I operate. Maybe other people do, but I don't. And I think here at Mainline, those are the type of agents that we attract. And we really put our clients first.
Yeah. So have you ever sold a product you're not getting commissioned on?
Yes. Oh, yeah, I have. I've helped people. Yes.
Yeah.
Took me a second, but I have. Prescription drug plans.
Yeah, there you go. Yeah.
Right.
Yeah.
And this year seemed to be more prescription drug plans. I'm talking about Medicare, standalone prescription drug plans. I feel like this year more than ever. I've had to help people with prescription drug plans that we don't get paid on. But
there's ones you could have gotten paid on.
But it wouldn't have been the right one for that client.
Yeah.
Yeah.
So you truly did what was right for them over your paycheck.
That's right.
Yeah.
Yeah. Because I can't go to bed at night if I don't do that. And I tell people sometimes, if depending on the relationship or the rapport I've built up with that client, I'll say, look, I'm not even getting paid on this, but I know this is the right plan for you. As if you're an agent listening to this, you probably also know that there are now certain prescription drug plans that are probably the better ones out there that none of us can help them with. They have to go straight to the carrier.
Yeah.
And I've told several people about that plan. But then I also follow that up by saying, if there's anyone else that family or friends that can use my help, let them know. And also, by the way, don't forget to drop that 5-star Google review.
Yeah, there you go.
So, and I do. I mean, my Google reviews have gone up. I'm at 130 plus-ish before this podcast. But I think a year ago, I was probably at like 30. So, yeah, that says a lot, I think.
Yeah, that's really awesome. It is. If you can describe your ideal client, who you're looking for, who would that be?
Anyone who needs help.
Okay.
I mean, really, I feel like we can help anyone, any walk of life, any cultural background, any demographic, any income. Really, my ideal client is anyone that I can help.
Okay, nice. Okay, yeah, because even on the under 65, you've helped people get onto Medicaid?
I have helped people get just yesterday.
And how much do you get paid for doing that?
I get paid a thank you.
There you go. Okay, got it.
Yeah, and maybe a referral.
Yeah.
I mean, but we help people any walk of life. But like I think I said earlier, I am finding kind of a niche where, so I'm born and raised here in the Chicagoland area. I didn't go very far. I live 10 minutes away from the home I grew up in. But the advantages of that are I have a pretty solid community. My parents were immigrants to this country, so I'm first generation born here. And what I've learned now is the community we've built over my lifetime, it's strong. And in the last year, 2 years or whatever, a lot of my parents' generation are coming to me now. And I'm like the name in the community to help with their Medicare and then their kids. A lot of times I'm getting referrals to their kids because maybe they're losing their job. Maybe they got laid off, or maybe they're going out to start their own business.
Turning 26 coming off.
Turning 26. Yeah. So I got a lot of my clients now from that community.
Got it. And here in Chicago, so what's your favorite food here? Chicago
Favorite Chicago food?
Mm.
Oh my. Well, I just had Lou Malnati's last night.
Ah.
But I also like Italian beef from Portillo's.
Mhm.
I like that here in Chicago, we can get any type of food from around the world at any given, whenever we want. Like if I feel like I want, I don't know, African food, I can go get it. And it's only like 10 minutes away. I just found a Jamaican restaurant, like literally 8 minutes from my house. I was so excited. I text one of our Jamaican agents. I said, look what I found. Yeah. So, yeah, I love that we can get whatever kind of food. I also travel a lot, and I'd say here in the Midwest, we're pretty friendly, I think. Like, we say hi to people, strangers, and I love it.
So, Saadia, Valentine's Day is right around the corner. And
Yeah.
what kind of plans you got? Or should we be talking to Hamid about that?
Well, okay, so long before Hamid, I actually have never really been a Valentine's person because I think it's crazy that we spend crazy amount of money for flowers and chocolate on one day. Like, I'd rather you just spend a quarter of that on any random day. But actually, funny you should ask, we are going to a comedy show on Valentine's Day. So I just got tickets for that. We need some laughter in our life, so we're going to a comedy show.
That's awesome.
He doesn't know about that, but that's okay.
All right. Well, he won't see this for a little bit.
Exactly.
Okay, good. So, Saadia, we wrap up our very first podcast here with On the Line. I do appreciate you being the first guest, and I thank you for it. Thank you for the 6 years overall and the difference you make, and thank you for honestly being on this. I was pretty freaked out about doing this. I had no idea what I was walking into. They just said, sit down.
Me neither.
And but yeah, so thank you. Any last words you want to wrap up with on your side?
I want to reciprocate that thank you.
Okay,
because without you, this place wouldn't be what it is. So thank you.
Yeah.
And I say that probably on the daily at home. And my kids know Arnie. Like, everybody knows Arnie. And so thank you. Like, you care. You care about us as agents. You care about our clients. And it really shows in your day-to-day interactions with all of us. So thank you.
Yep.
I think it goes back to our family, the mainline family. That's really why I'm here. I'm telling you, I don't have to do this. But what keeps me going, even in because let's be real, sometimes I get a little frustrated, but that's what keeps me going. So thank you.
Yeah. Okay, cool.
And thanks for having me as your first
awesome.
podcast.
Thank you.
What am I, like a podcast?
You're the podcast queen now.
Queen?
I think so.
I don't know about that. Princess?
Okay, we'll go with princess.